Well, good evening, everyone, and welcome to Sisters for Harmony. This is a show that we have been wanting to get to, and we are very excited that we are here tonight. We have, of course, none other than Brother Omoja, who's going to open us up in our regular way, and then we're going to jump right on into the show with our now sister co-host. Dr. Ramantal, she ain't a guest no more. We gonna take that title off. She now just she a co-host
That,
with the rest of us.
All right.
that's
I
right.
love
She,
it.
All right.
she got a chair on the table with her
I'm
name
saying
on
she sure does. She sure does. Ain't no little sticker on there no more. It's embroidered on there. And
And
with our special guest, Portia Holland. Oh, now I said it was easy, and then I didn't write it down, and it's cut off. Give it to me again, Portia.
Portia Holland-Otunba.
Tumba, yes. Unfortunately, all I see is on tomb, just a B. So, all right. So, Brother Mojo, would you please open us up?
Sure, Dr. Walls. Well, first and foremost, we want to greet everyone in the name of God and our ancestors in whose footsteps we most humbly walk. We welcome you to Sisters for Harmony, where we look to enlighten. What happened? Oh, we look to enlighten, empower, and educate people on some topics. So, welcome to Sisters for Harmony.
Hmm. All right. So tonight we are going to be talking about Black maternal health and what got us here. So, what I'm going to say initially is what got us here was Dr. Louise Wade, our veterinarian friend to Green Street Animal Care and a veterinarian of Winco Animal Care Hospital. So, if you need any veterinary services, we encourage you to reach out to Dr. Louise Wade. And she was listening to a show we did one night. And right afterwards, she sent me a message and she was like, "You got to have Portia on your show." And I was like, "Okay, well, what does she do?" And so she sent me your website. And I said, "Okay, is this somebody who you know, or am I doing a cold call? Like, tell me how this goes." And she was like, "No, I'll take care of it." I said, "Okay, no problem." And then Portia and I went back and forth. And unfortunately, the first time she was supposed to come on, she ended up getting sick. And so then we had to wait and reschedule. But it was something that we were holding near and dear to our heart. And so, Portia, we are so thankful you are here to join us this evening. So please tell the people a little bit about yourself before we get ready to jump off into this very important conversation.
Yes, thank you so much. And shout out to Dr. Louise Wade, my fellow Tuskegee sister. We
Oh,
play no games at my HBCU.
come on.
So that is our forever connection
Yes.
there, but also just an amazing human and
Mhm.
person and lover of people as well.
Yes.
So, yes, I am Portia and I am a wife, a mother of two girls, and I am a Philadelphian. Most importantly, in terms of the context of the work that I do, being
Mhm.
born in Philly, but also giving birth to both of my children in Philly.
Okay.
And so, as one that identifies as a Black mother, this topic is huge to me and became my reality as I gave birth to my first child 7 years ago. And
Mhm.
the work has since drawn me in to really advocate and educate others about the state of Black maternal health, where we
Mhm.
are in the US, particularly, and the tools that are needed for that journey and ways that others can actually support the fight, because it literally is a fight. We're having to go
Mhm.
to battle almost daily to protect the lives of our birthers and our children.
Yeah. Yeah. Thank you so much. I can just run all types of places with that, but I'm gonna wait. Dr. Ramantal, anything that you want to say?
No, I firmly believe in having conversations, regular conversations about this topic because it's huge. And unfortunately, it's something that is not brought to the forefront. It's hidden under the guise of, oh, it's an access issue, as if, it's a situation of Black women not being fully insured or not having any insurance at all. And it goes beyond that. It's structural racism and some other pieces, biases and other things, which I'm sure we'll get into. But certainly if you saw other groups with the same numbers, deplorable numbers in the US, for mortality, maternal mortality, and even infant mortality, I think there would be a moratorium. There'd be all kinds of things to prevent that. And we don't see it happening. So we need to create this space to have open conversations so that we can develop our own solutions and work together to take care of that. So I'm
Yeah.
happy to have this conversation.
Yeah, I have a cousin, Shanae Adams, and she's a doula, and she has a business called Wellness from the Womb. And when she started talking to me just about all of the different aspects around maternal wellness, and she's a mental health clinician, so it was combining both together. So these were conversations we have been having backstage, and the traumas that take place during the birth process, the lack of information that sometimes is given, and how many times medical teams will just take the jurisdiction to do what they want with a patient, for the sake of, but not informing the person to make the decision. It was just traumatizing hearing some of the stories. And then there started to be stories on the news. And then there started to be statistics that were given. And it was like, this is such a hot topic that we need to talk about, and it needs to stay on the forefront for our well being. So, Portia, I see you shaking your head more than just a bobblehead. So, what's going through your mind?
I'm just like, yes, 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 amen. We have to talk about this. We have to. What is a society? What is a group of people without mothers and babies? Like, and so if reproduction and maternal health and infant health isn't something that's protected or a priority for a people group, we got a problem. You're talking about you're cutting off your future, right? But to your point, where are the numbers an issue really, and for who is it an issue really? Right. And unfortunately in the US it's terrible in terms of Black identifying folks, and it just speaks to our country's continuous nature to want to erase and that to erase us. And if you can do it at the womb, you don't even have to worry about us later.
Yeah. As I was mentioning, I was at a all-day seminar, maybe about September, I think it was September, October, and I was one of the speakers. And one of the people who spoke before I did, she talked about how during her first pregnancy, she didn't know. She didn't know anything other than what her doctors had told her. And she started cramping and experiencing a lot of pain. And so she called the doctor, and the nurse or whoever she spoke with, it wasn't her OBGYN, but who she spoke with was like, oh, don't worry about it. It's common. And she's like, okay. And so she continued to be in pain. And it was like, if it continues, call us back. She continued to be in pain. She called back, and it was again very dismissive. And then finally, she and her husband were like, we're going. And they ended up going to one hospital. Well, it turned out they did not have the facility to assist her. So then she had to go to another hospital. And all the while, she had been having contractions. And they were like, well, why didn't you come in? And she's like, I've never been pregnant before. I kept calling, and they kept telling me to wait. Well, needless to say, there had been a lack of oxygen to the child and so forth. And so there ended up being some neurological damage and physical damage. And so I'm sure that's one of, unfortunately, many stories that have occurred over the years. So, Portia, why don't you share with the audience your story and how this even became a part of your reality?
Yeah, sure. So it is my story that brought me to this work. I am one that identifies as a birth trauma survivor. So my first child Um, Textbook pregnancy in terms of beautiful and great, but now as a birth worker, I realized I had an unnecessary induction, which can be multiple processes to force labor to come about or to speed up labor.
Mm.
And so people respond differently to it, babies respond differently to it. And so, in the midst of what we call the waterfall or the cascade effect, where there's one medical intervention after another to keep one thing from happening, to control another thing, it often ends up in an unplanned cesarean. And so that was me. My baby was healthy, but because of that, that's a traumatic experience in and of itself,
Mhm.
your body,
Yes.
but also a very weird outer body experience to be a
Mm.
cesarean birther. Um, it led to some challenges around lactation. So I end up in a situation where it's like I planned for none of this. I feel like I wasn't really included, informed. Things were done to me. Things happened without explanation and
Mhm.
without true consent. And I was able to put words to it once I became a birth worker a year later and
Mm.
trained and understood what had happened.
Mhm.
So I have a baby on my hip, cold calling people in Philly, any maternal health organization, anyone that would listen. I was a nurse family partnership mom at the time, NFP, we call it. Amazing program, nurse home visiting program for first time mothers. I highly recommend joining. And they supported me.
And
They
what are they called again?
nurse family partnership.
Okay. For those who are just joining one of my shows for the first time, I always tell people make sure you have something to catch some notes because you're going
Yes,
to hear something that is going to be important. Of course, you can always replay it. It'll be on the YouTube side of life, uploaded forevermore at Ask Dr. Walls 525. Be sure to subscribe. But you definitely want to make sure you have something to capture some of these notes and terms and thoughts down as we're going along. Go ahead, Portia.
absolutely. And I'm a resource queen. So you're going to probably hear a good dozen of names of
Okay,
organizations. Your girl got receipts. I don't just do this work for play.
come on.
So listen, nurse family partnership was everything to me. They helped me get connected with multiple resources. In addition to a doula, it was late in the game, but I did actually get some type of support. And so I relied on them. I hit up people at Maternity Care Coalition or MCC. They provide full service of supports from pregnancy to early parenting years. And I think 4 counties, including Philadelphia County. So Maternity Care Coalition is also a resource. And I got somebody on the phone and they said, well, you need to train in this work. Because I'm like, hold on, if Serena had this issue
Mm,
carrying a white
mhm,
man's baby,
mhm.
I know I come from a good zip code in Philly and I got a master's, but clearly we have an issue. If Serena had an issue,
Yes,
we already know the rest of us probably ain't gonna make it. I
yes,
mean, ain't gonna make it.
yes,
And
yes.
so that really spurred me into this work. And because I was capturing my journey on social media, people knew all about my pregnancy, all about the
Mm,
challenges, and they knew that I was starting to train. So I started to train as a breastfeeding peer counselor, then a birth doula, and multiple certifications and experiences later, I found myself providing direct support during birth, right
mhm,
after the baby is born, which is the postpartum, in lactation. So getting that human milk into that baby's body.
mhm,
And then I was pregnant again and had to really go through this journey again, now pursuing a VBAC, which is a vaginal birth after cesarean,
okay.
and having to pull on my Philly resources and talk to my midwives and all these
Mhm,
folks to explore my options. So I then went into lived experience again, but with the birth worker's mindset and with the expertise around maternal health to get a different outcome. It was a different outcome in that I was fully in the driver's seat and in control, and I was telling them what to do and how they wanted
mhm,
to do it.
mhm,
But I did end up having another cesarean and I had preeclampsia. And so that is what made some things move in a direction that I wasn't expecting it to.
mhm.
Uh,
Can we take a pause for a moment because that's a lot, right? And I'm thinking about the audience as they're listening and partially emotionally going through this journey with you. So you have this first experience, and it's mentally a challenge, it's emotionally a challenge, and it's physically having an impact on you as well.
Yes.
And now your body is still responding and or calming down from all of this, and then you're pregnant again. So you haven't even gotten through the trauma of what happened first before now you moved into pregnancy number two.
Well, there were a few years in
Okay.
between. There were some years in between, but trauma and loss, I feel like is forever. You just kind of
Mhm.
go through, you may stay, there's stages to grief, but it's like
Mhm.
a roller coaster. And
Mhm.
so, though I was doing the work and had come out on the other side, so to speak, therapy, support, my church, praying, sitting with the Lord, all those things, there was still a very, I peed on the stick and was not happy this time, like
Right.
really not happy, because I knew what it was like to give birth as being Black in America. And
Mhm.
COVID was popping off. And I knew that though I wanted to give birth in another country, my husband wasn't going to be happy with me leaving.
Wow.
And
Mhm.
so it was a different scenario of both times I was a part of that 50+% of people that have unplanned pregnancies. Over 50% of pregnancies are unplanned. So I was in that category once again, but not sharing in the joy that my husband was.
Mhm. Mhm. Dr. Ramatal, what's going through?
Oh
Yes.
no, I was going to ask Portia a question because it seems like you really got involved in advocacy for Black maternal health after you became pregnant. I was going to ask you, what industry were you in before that?
Sure. So I was doing a lot of work in national service, and civic engagement.
Okay.
I was teaching at Drexel University. I'm an AmeriCorps alumni times two. And so I
Okay.
was doing a lot of consulting, speaking, and teaching around action building and movement, community building, but it was general, it wasn't specifically focused.
Right. Right.
So this this passion that I always had for pregnant bodies and mothers, being a nanny, being a
Mhm.
caregiver, getting a biology degree and focusing on public health, it came to fruition once I had that child and was like, this is why that was there all along. And
Yeah.
this is why you went to Tuskegee and walked the line of these Black midwives and nurses that were trained, and on that Alabama red clay. And
Mm.
this is what you were being built up for, kind of came to fruition after birth.
Mhm.
No, that's beautiful. No, you can hear how passionate you are. And my brother went to Tuskegee, so big up to Tuskegee. I went to HU. So I love HBCU. I wanted to ask you that because a lot of times I'm finding that Black women in particular, those who are advocating, usually are coming from a poor personal experience, whether it's their own or it's someone that a loved one, another loved one. And I
Correct.
just find it interesting that we end up having to take on everything all the time, just Black women, the burden of everything. It's never a relax, I'll help you, until you find maybe another Black woman who is just like, I'm here for you, I'll support you, and how can
Mhm.
I advocate for you? So I just found it interesting that that's how you. I wouldn't say you fell into it because I feel like it's your calling, you know.
Absolutely.
Mhm.
Absolutely. Absolutely. And I said yes. And then I found a way to monetize it because we are too busy saving the world. And we actually have been carrying society all along. But
Mhm.
it's time that we get paid for the ones that didn't get paid,
Mhm.
for my aunties and great great grandparents that didn't get paid. It's
Mhm.
time that we collect a check. And that's why I was very serious about moving my work into a business and making sure that I charge people.
Yeah. So let's talk. Well, before we go into there, Brother Moja, thoughts, questions, comments?
I'm just listening. I remember when my son was being born, and I went to the Lamaze classes and stuff like that, and just like it puts, for a male perspective, it puts you in a different mindset because um, it's like you're learning how to help the woman with this childbirth, and how do you mentally you can't be there, but physically you can, and just support her. So as I'm listening to all the stuff that Portia is talking about, it's like, wow, those are the things. What can we do? We can stand by and ask questions. How can we help? What do you need me to do? Um, and try your best to accommodate the sister with what's going on. But for the men, from a man perspective, we we can't we just can't. I can't even find the word. You can't identify. You cannot really be there fully, but you can be there physically. Just rub the hands, bring the hair back, rub the shoulders, get some positive words of affirmation. What can we do? So I'm listening to us like, wow, what did her husband go through? Phew, I like to have him talk about this. I'm like,
Well,
what did he go through? I'm like, wow.
I'm glad you said that because, and Portia, I'm going to give you space to answer that question. I think about, like I said, I mentioned my cousin Shanae and how when she's working with families and she is talking with the men about what they need to be paying attention to, what they need to prepare for, what they need to be that extra set of eyes and ears and that mouth to advocate when the woman cannot advocate for themselves in that moment. So go ahead, Portia.
Absolutely. And as you were vocally processing there, I was like, yes, that's correct. Because in most cases, men are looking for a way to actually physically show up, provide, protect, do a thing. And there is so much that's out of control in terms of birth, not in this chaotic way, but just we cannot manipulate it. We can try to do things, but you do not know the outcomes. You just don't know how it's going to flow. And so with that in mind, in terms of men and how they show up, I first learned the best way to go about this by actually supporting couples and supporting partners as one was pregnant and they brought in a partner, they brought in their husband, whatever the case may have been, and how to actually make sure their voice was heard. They were being seen in terms of appointments and sessions. I'm looking at both of them. I'm addressing them as the unit that they are. I'm ensuring that their questions are answered. And this was my role as a doula. So we provide physical and emotional support, education, connections to resources and community. And we walk you through that pregnancy, labor and birth, and early after birth stages. And so, Dad, if you wanted to be called, okay, Dad, you need to be in on this. When that baby comes out, do you know you can catch the baby? That can be your job. Do you know that you should be doing skin to skin too? So before I left a hospital room or a birth center room, I made sure Dad took his shirt off. I said, I ain't worried about you. And she done seen it already. Take that shirt off and get that baby on you. Before I leave, before my job is done after this birth, that baby will be on your chest because they heard your voice. They want to smell you. They're going to want your heartbeat, you and the mother. That's who they want. They don't want me. I'm just the doula. I'm just here to help you get through this process. I'm not holding this baby. You are. And I ensure that their hands are placed in such a way that they're comfortable, that they can change a diaper if they've never done it before, that they have already had some type of education about bottle feeding and breastfeeding and the first poops and how big their stomach's going to be. They were a part of my sessions. They were a part of the conversations. They were pushed in and included in the decision making. And so that to me is where being intentional about getting fathers and male partners begins. And having supportive people on your team that respect that makes a difference. Because if your doctor or midwife, which is the person that is typically managing your care, right, is not including your partner, is not acknowledging Dad, encouraging that person, encouraging that man to insert himself. Okay, so Doc, so what did you say to my wife? Hello, right? Getting yourself in there.
Mhm.
and making sure that space is being created. And so that's one thing I challenge birth workers, maternal health providers, home visitors, social workers, include that father, especially in the Black community where they are present. Please make sure they're included.
Absolutely. Absolutely. My husband was included in everything. He was just like, I'm going to deliver the baby. I was like, no, I would like a professional. He's just like, I'm going to be his understudy. Don't worry. He
I love
was
it.
like at all the appointments. He was asking as many
I ain't go
questions as
that. I didn't go that far, but that's
he thought he was going to deliver every baby. We have 3 children, and it was 2 planned. The last one was a beautiful surprise because it was a boy, and I had 2 girls. But it was interesting. So I really love to hear that you are including the men as much as the women and keeping them involved, because a lot of times they're left out. It's literally, they gave me a ride here. And that's not enough. And they want to be involved. And my husband loved the skin to skin time. He was changing the diaper because I did have to have a C-section. So where times I didn't, he was like, I'm bathing the baby first. I'll do this. He was really hands-on. So I really love to hear that you're encouraging that, because there are some that are out there. They may be a little scared or timid, but they get involved and they love to be involved. Honestly.
Yes,
yeah.
yes.
'Cause I
Yes,
know what,
yes.
yeah, I know. Like when my son was being born. I mean, like I said, I retook the Lamaze classes, and I remember when his mom gave birth a month early because she caught the chicken pox while she was pregnant with him. And so right after she gave birth, she had chicken pox from her head to underneath, all the way down to underneath her foot, her feet. And so she left the hospital. He was in the hospital for a whole week. They wanted to check him out, make sure everything was right. And I was working the second shift at my job. So like the nurses is really cool. They waited until I left my job at 11:30. It took me like 20 minutes to get to the hospital. They used to wait until I got there, and they let me in because I was like, well, he was the only Black African American. I was like, I'm coming to see my son. You guys better set something up, because his mom's home and he's in the hospital. He's in IC. He's in an incubator by himself, in a room by himself. So they were really cool to let me come in, change his Pampers, feed him, sit in the chair, feed him, and stuff like that for the week and stuff like that. And I think they were a little surprised to see a Black man doing that.
Yeah.
So I was like, and people who know me know how my Lucian blood was. was like, I was like, I guess the way I spoke, just let them know that, as a man, I was going to be there for my son. And I think that sometimes we have to advocate. Unfortunately, we have to make our voice sound very stern to advocate for ourselves. And even though we're not in the medical profession, we still can say certain words, certain ways to make people know that we do care, we want to be involved, and you can't shut us out.
Yes.
And that was, for me, that's what it was about. It's like, it's my son, I'm coming. I used to say to him, I get off work at 11:30. I'll be here by midnight. I'll feed him and stuff like when I come in. So like the nurses who were on the floor at the time, they knew it, and they were really cool about it. And I was like, I think the way I spoke to them, being the only African American baby on the floor, they were shocked. They were surprised. And so I think sometimes we have to advocate, and every night I had to go home and give his mother a report on how he was doing and so forth and so on. And this is before cell phones. Okay, so there was no picture. This is before cell phones and all the cameras and everything like that. So I think I'm glad what you're doing. I think it gives men an opportunity to be more vocal, to be more present. And understand that fatherhood starts before the child is born. I think that's important. That because I used to sing to her. I can't sing, but I used to sing to her stomach and stuff like that. So I remember that because it was important to me because I didn't have a great relationship with my dad, and so like I tell my wife all the time now. I say I tell people all the time. I made it my duty from the time my son was born, even before he was born, saying, I love you. I love you. So he heard my voice while he was in his mom's womb, and he came out, and now he's 34 now, and we still say before we leave he has two. I have two grandsons by him, and before we leave the phone, we always say I love you. It's just like a natural thing for him to say. It's a natural thing for me to say, and it just brings to me. It just reminds me that what we start, we should finish it, and it's a continuous education, and it's to build that trust, because I know I see him and how he's doing, how he is with his two sons, and I always tell him, I'm proud of you, man.
That's good.
I think that's important that we, as men, especially as Black men, make sure we pass that down, because I see him out there, his first son and his second son, he's like doing all the things, he's carrying them around, and I'm just smiling at him like, wow, because I made sure when he was young that I made my duty. I mean, I used to go to the gym 5 days a week before he was born. After he was born, I stopped going to the gym for like 3 months. And I was like, my friend said, you gonna do that, man? You should be, yeah. I was like, no, this is my son. I mean, the first week, 2 weeks, third month, whatever, he's never going to live that again. I think we may have to remember that. It's not like, oh yeah, I'm going to go to the gym, come back and do this. No, when that week is gone, you're never going to have that week again.
Yeah.
You're never going to have that month again. It's done.
That's
and
true.
what did you miss?
That's good.
The football game, the basketball, you can watch the rewind. You can go to ESPN and watch the highlights. You can't highlight your son. You can't highlight your child.
It's so true.
That's what those people. I never highlighted him. I never highlighted him because and if I had to do it again, I'd say, yeah, I'll just stop. I stopped going to the gym and everything because I wanted to be there when he woke up in the morning. I was there when he took his first steps. It wasn't his mom. I was the one. I told her about it. I was like, yeah.
Showing off.
And back in those days, we had the big VHS camera, so I was a bit trying to videotape him. And it's like so I was the one who told her about his first steps and stuff like that. And I remember falling asleep on my chest while we was sitting there on the couch. He would fall asleep on my chest and stuff like that. And I wouldn't move. I couldn't move. I said, Lord, thank God I ain't had to go to the bathroom.
Well, let me ask this. I don't know. Can y'all hear me okay? Because I'm having.
I can hear you.
All right, I'm having these technical difficulties. Portia, this is exactly how it was the first time Dr. Ramantal was on. The computer went all crazy. I think it's all the positive energy. It's having difficulty accepting it all.
Wow.
But Brother Moji, you mentioned the word highlight, and you're really talking about the male father side of this. Portia, talk to us about male doulas and the rise of that within the industry and the importance of it.
Yes. So we do have some doulas that identify as men, and they take on that traditional role like I talked about. You can have several different kinds of doulas, but for the sake of this conversation, we're talking about a birth doula or a postpartum doula. And so that birth doula is with you in pregnancy. They're supporting you virtually or in person during labor and birth, whatever that looks like. And they're having some check-ins in the postpartum. A postpartum doula, typically you make a connection with them while pregnant or shortly after birth, and they're helping you logistically kind of adjust to the newness. So they might be at the house a couple nights a week. They might be helping you with a feeding plan, cleaning, running errands. They possibly may hold the baby so you could take a nap or a shower, right? Mm-hmm. They might be cross-trained in mental health or lactation, so they can also help you there. Mm-hmm. So there are some male identifying doulas that do that work. I remember hearing about one brother who I believe was supporting his sister, who was a single mom. And he ran to the hospital with her and was all up in there and got exposed to everything. He was her support person. He was like, I need to stand with other women, right? I need to stand with my sisters, not just give them a ride, like you said earlier, but be there with them. And there are a few that do that physical standing in the gap supporting work. But then there are also dad doulas that come about with that similar concept, because a doula typically is seen as a female that comes around another woman. And so there are some dad doulas that come in to train, support, help, resource the fathers. So they're going to say, bro, do you know what a placenta is? And they're going to be like, what? What is that? You know, where did that come from? They're going to be the ones jumping in with education and resources to really help any males that are present in the family. And so we're seeing brothers pop up with amazing resources and events, trainings that help guys get ready for their babies to come. And it's getting a lot of support and traction because a man can really do better speaking to this role with another man to say, I feel you, bro. I'm overwhelmed. Got to pay the bills too. But how can I hold her hand as she's throwing up for the 50th time during this pregnancy, right?
Yeah.
And they can really empathize and help each other, but also catch warning signs.
Yeah.
Bro, you said your girl is seeing lights and she's hot and then she has a headache that won't go away. Bro, that sounds like preeclampsia. Get her to the hospital right now. Right? So they're also being trained in ways to identify warning signs and issues physically and with mental health so they can be on the front line supporting that partner, supporting that sister that would otherwise could be sitting in the house with the issue and nobody knowing.
Yeah.
He's not aware.
I love so much of that. I had to take a moment because there's a baby trying to get your attention. Journey says, hi, Grandma Portia.
My God, baby. Hi, hi baby.
I can't let the baby wait too long. All right. All right. Before I go, Dr. Ramantal, anything you want to jump in and say or add?
Yeah, actually, I'm interested in hearing from Portia about, she mentioned earlier for her second pregnancy, she was interested in going abroad and her husband was not. And I know he's from another country. So I was interested in hearing a little bit more about why, because Portia, my work on YouTube is my Medical Tourism RN 812 is my channel on YouTube. And I educate and inform Black women in particular about any aspect of medical tourism if they decide to seek any type of treatment abroad, because they typically go to countries where people do not look like us live there, and they need to know a little bit extra and arm themselves with more information to share with those clinicians who are skilled, but they may not have some of the nuanced information specific to Black women. So I share all that type of information. It could be for IVF, it could be for cancer treatment, elective surgeries, whatever, but it's just education. And so a lot of my viewers have come to me about birthing experiences abroad because they're interested in that, simply because of the deplorable rates here in the US. So some are already pregnant and they're asking what's the safest country to give birth. And some are interested in becoming pregnant and are asking about it, or they want to seek out IVF and ask me to share what countries are the best for IVF. So I'm just kind of interested in hearing a little bit more about why your husband was not too interested, especially since he's from another country. Sometimes people are so accustomed, especially in an African community, where you may not call him a doula, you may not call him a midwife, but you have the elders that are doing exactly those things. So I'm just a little bit interested in hearing that.
Yes, absolutely. And I love that. And as I'm considering, and my family is considering exiting the US,
Me too.
I'm looking, listen, I'm doing my research because I'm like, where my people going to be? Where in the globe are my people going to be where I'm hopefully won't have to feel like I'm fighting constantly. And so for me, my husband is Nigerian of the Yoruba tribe and from West Africa. And he, at the time of my pregnancy, we had a honeymoon baby. And so at the time of the pregnancy, he was not yet a green card holder. And so he would not have been able to accompany me. So that was number one. Number two, he is very bent on like, let's make sure we're established with our citizenship in multiple places. This is my first daughter. She is Nigerian. I need her to make sure she's cool here. But I have a good girlfriend who was actually going to be in my wedding, but took the role of a lifetime doing therapy for the government at a military base in Germany. And so she told me about her reproductive, her maternal health, her overall wellness. Any concerns that she had before completely reversed. food, herbs, the
Wow.
environment, everything.
Yeah.
And she said, Portia, you don't want to come here, girl. They'll treat you like a queen. You should see how the facilities are. You should see the support and the food and how you can lay up and the costs, right? And how you'll get loved in the postpartum. And when I tell you, even though it was COVID, your girl was getting ready to stamp that passport and go right on to Germany.
Mhm.
Don't know a bit of German. She was one of the only people I knew there, but me and that baby was about to be in Germany. Okay.
Mhm.
That was just the reality. I thought about it, right? If I was maybe single by choice or, wanting to be in a place of, disrespecting my husband, right? Then I
Mhm.
probably would have done it. But that
Mhm.
was literally not because of fear, but just I knew I was going to be treated better.
Yeah.
But my situation was nuanced in that I'm very well known in Philadelphia for my work. So though I opted to have a hospital birth and then preeclampsia came about, so thank God I didn't have a home birth. It could have got very messy.
Mhm.
I literally, those folks were walking on pins and needles when they saw my name in my chart because of the work that I do locally.
Mhm.
Everybody was on 10. And so the care and the service was stellar. But
Mhm.
why? Because you're threatened by the work that I do and who I am in the community, not because I'm a Black sister from Philly trying to give birth in Philly. That's not
Mhm. Mhm.
right.
That's wow.
Yeah.
Powerful.
Yeah. Yeah. Tell me this. So, first, real quick, as far as education differences, what is the difference between a doula and a midwife?
So a doula is not clinically trained and does not do any clinical duty. So we, and I say we, though I'm retired, we are not drawing blood. We're not running labs. And we are not in a place to actually be the primary person to help you as you birth your baby. We're
Mhm.
supportive, resourced, and trained in a different way. More often than not, it's more of a short-term training where you could get a certification by many certifying bodies throughout the globe, actually. Whereas a midwife is more clinically trained, whether they're traditionally practiced, they are a CPM, certified professional midwife, which
Mhm.
typically does home births, or a CNM, certified nurse midwife, which typically works in the hospital and the birth center settings. And
Mhm.
so for the CNM, they're a nurse. So they done went to school, they done got themselves a degree, honey. Okay.
Mhm.
So totally different scope of work. And they're both a part of the birth team. So you should absolutely consider who is going to be that person providing your primary care, an OB, GYN possibly. You might have to have maternal fetal medicine, MFM, and you might also have a midwife that you can choose from. Whereas your doula is a supportive additional part of that team,
Yes.
but the two are not the same.
So I love the fact that you're talking about a team. And I don't know if a lot of people sit and think about having this team, this community, this support system around them during the entire process. So I like this, like I said, I like this idea. I like this new reality for people to consider. And also, not just for the woman, but also for the father in
Yeah.
the situation as well to help give them the support. I know recently there's been more talk about the paternal postpartum depression. Do you want to speak to some of that, Portia?
Yes. So one of my certification areas is in perinatal mental health. And perinatal refers to that period of pregnancy through early postpartum, about 1 year. And so, in that regard, I'll just shout out an organization, Postpartum Support International, is one of the leading perinatal mental health global organizations, Postpartum Support International. They provide direct supports for families and education and resources for the free. And they also train people that care about families like me and want to do this work around mental health.
Mm-hmm.
And so, what I have seen through my certification process, but also through the work that I do, and even in my husband, since we speak at events together, mainly my own event locally in Philly, and he'll say, I didn't have the words for it, but how do you think I felt? She had COVID 3 times. She had an unplanned cesarean. We were at the hospital for almost a week. Then she got COVID again, and none of our family could come and help us.
Mhm.
And then she's up. I was literally out of it. I had my own mental health challenges. I'm crying all day long. An
Mhm.
exclusive pumper. My baby did not latch at the breast. So I'm pumping milk 8 to 10 times a day to give her breast milk. And all of us are just crying and screaming.
Mhm.
And so, though he didn't say at the moment, hi, I think this is depression. Oh, I need a therapist. Coyote was trying to keep us together,
Mhm.
just to be real. But
Mhm.
hindsight, he has talked about his symptoms. And since I'm certified in this area, I'm like, oh my gosh, look at what my partner was going through.
That's right.
But I was so wrapped up in my intrusive thoughts and my depression and my recovery that who in the world would have asked him really how he was doing
Right.
outside of my own mother? My mother made space for him, made him
Mhm.
rest. When I did get over COVID, she provided for us. And so we're seeing fathers and partners being impacted by perinatal mood and anxiety disorders or
Mhm.
PMADs at a rate catching up to that of even women.
Mm.
So to say that a partner, a dad, a father is not impacted by what's going on with
Mhm.
a woman, with a baby,
Yeah.
that's ignorant. They
Yeah.
absolutely are, and there's data to prove it.
Yeah. Thank you so much for sharing that. And I think it's so important as we look to build our community, increase the health and well being, and reclaim so much of what was taken and lost over generations. What I hear you doing is reestablishing, again, things that were lost and things that were taken and things that were forgotten about. Because from the infamous line that people love to quote, it takes a village. Well, we got to build the village. We have to have the healthy village, and that is to take care of everyone within the village, the mother, the father, the aunties, the uncles, the supports, right? Everyone, including the child, because it's all hands on deck.
Yes, absolutely. Absolutely.
I have a question for you because I was interested in hearing a little bit more. I know the team based care approach is best for anything, but especially when you're going to bring another life into the world. The CNMs that you mentioned, how frequently do you see them actually in the hospital? Because I
Mm.
don't. I know they exist, but a birthing center may introduce them more than I find the hospital. So, how often do you see them in the actual hospital setting?
So it really does depend on where you are geographically. And there are more people becoming more interested in the field, and it's growing as we're having more conversation and supports. But it is a process. So you'll see people train and become an RN first, and then kind of make their way through, right, the midwifery track. And so some of that has to do with capacity, time, their own life, all of that. I will say in Philly, we were at a place where just about all of our birthing hospitals did have some midwife presence. It's not quite the same that way anymore. Our greatest presence is at Jefferson and at Pennsy, being Pennsylvania Hospital. That's where our greatest presence is. There is a whole midwifery suite at Pennsy, Pennsylvania Hospital. And so, because there is this kind of limited number of people, there can be a lot of them being filled up, overwhelmed in terms of the care during pregnancy. And then, of course, we're seeing that they have a rotation on L&D, labor and delivery floor. So you never know which day, which night, which shift, if which midwife is going to be present. But in
Right.
terms of those that make an effort to really staff their hospitals, definitely something to ask questions about, to research about, and to see. But there's not as many numbers as we would hope, right?
Right.
In
Right.
the same way that we look at the OBGYN landscape and obstetric deserts all across the country, we can just imagine how few there are of midwives if we don't even have enough OBGYNs in within mile
Mhm.
radiuses throughout the country, like in Georgia, for instance. And
Yeah.
so, yeah, we're starting to see an uptick more. And some are desiring to do more of the traditional path. So they're not going to be connected to the hospital system, right? A full
Mhm.
Mhm.
visit. they're going to do home births or traditional births in the community.
Yeah, the birth deserts that you're talking about, I know a number of places have shut down their OBGYN units, and unfortunately, they've been in predominantly Black areas in in the South, rural, and even in some urban places. But it's interesting because I know we talked about the differences between a doula and a midwife may have more clinical experience, but there's, I think it speaks to the support of a doula, the fact that in America, you know how important insurance is, and insurance does not typically cover, at least the private plans don't typically cover doulas and midwives. But recently, Medicaid at least started covering doulas in some states. I know in Florida, where I live, they're covered, and they're going more and more into that. So I think that speaks to the need and the importance of having a doula, and what they all of the things that you bring to the table is really interesting, because that's something that's actually included in other countries. Doulas are really kind of, it's part of the entire package. It's not extra in other countries. And the midwives are staffed at a lot of hospitals outside of the country, and they only report to a physician, a OBGYN, when they come and take report from the midwife who was there the entire shift. They're just there to kind of do the last piece, but the midwives are running the show. The doulas are there pre and post, and that's all a part of the country's birthing package for that woman.
Yeah, and it's actually a nice model. It makes me think about, if anyone has saw the show on Netflix, Call the Midwife, and the OBs were called in. It's beautiful, beautiful series. I forget how many seasons they're on now. I cry every episode, but it really talks about some of the nuances of birth and how in the time period and the time setting of the show, the OB, which was of course was a man, was called in only if there was an issue, if they couldn't get this baby out, if forceps were needed, if a cesarean was needed, if surgery was needed. But the masters of birth, normal physiological birth, the ebbs and flows, stages and phases there are to labor and birth, the keepers of that information is the midwife. They're trained in that. And also doulas are. Most OBGYNs, they are surgeons. They are trained in surgery. Many of them have not seen a baby be breathed out through the canal vaginally. And so they're going to lean towards what they know, and also towards what is the bigger payout. If you come in, you 7 centimeters, you breathing like a champ, all you got to do is take a poop, how much money they getting off of you? But for anesthesiology, for all the 50 million nurses that got to be in the room to cut you, and all the other people that got to be in there, talk about a payday. Talk about a payday. And that's also why we see unnecessary cesareans taking place at a very high rate, right? Because that's what they're leaning towards, what they were trained in. And it also is a bigger payday.
Financially.
Wait, so financially, that speaks to, you know, you say we have to get paid, you know, and for your services, as you should, and they're critical services. I'm curious about that, because those that want to use a doula, if it's not covered by their insurance, do you get a lot of pushback from those? Because a lot of people want to use it. They want to create their own birthing plan and feel like they're in control and supported for whatever birthing plan they desire. And they don't typically get that in a hospital setting from an OBGYN. It's like follow the process line or whatever the case when it comes to. So I'm just curious, do you get a lot of pushback? Because if it's not covered, where do they find the money to use your services?
Sure. So when I was practicing, I retired when I was pregnant with my second. I did my last birth then. When I was practicing, I had everyone from somebody running into me in the street, and I was able to support them through an organization like Maternity Care Coalition, where they had a pot of grant funding and also relationships with some insurance companies to be able to cover people. So some community-based organizations and nonprofits get grant funding, or they had relationships with insurance companies. This was all before this big spread of now each state trying to advocate, right?
Mhm.
But for the most part, it was cash pay. And depending on your cost of living, baby, a doula in California might cost you $5,000.
Yeah.
Okay. New York might be around 3, right? And so people were getting their money together, or they were raising it, or they weren't having $5,000 lavish baby showers. They were actually using it to support their life.
Mhm.
Okay.
Mhm.
And so for those that I met privately, they had no problem cutting their checks to pay me my rate. And if someone, truly didn't have it, there was an option for them. The unfortunate thing, because though I'm all about this support, I am a coach. I coach birth workers to be able to build sustainable businesses so they can take care of their family. And so one thing I do encourage us not to do is do anything for free. Use OPM, other people's money, right?
Mhm.
White tears are real. There's a whole lot of white folks crying and sad because we're going through this. They're cutting money. I've gotten plenty of it. I've gotten plenty of it. Take their money and take care of your people. But I, Portia Marie Holland-Otunba, ain't doing nothing for free. I'll take OPM, other people's money. I'll do crowdfunding. You can start a registry and have people to donate to help a family in need, right? You might want, if you have private insurance, your HSA, FSA might cover it, boo. I've had people cover it that way.
Yeah.
It can cover breastfeeding and lactation as well. So
Mhm.
we can find a way to get you the money to make sure that the person providing a professional service gets paid, but free, not today. Somebody has to get paid. I don't care how you get the money, okay? But you got to get paid.
So,
Yes.
Portia, tell us this recommendation for women of color who find out. Let's start with they decide that they want to have a child. Let's say it's planned, and or they find out that they're pregnant. What are best next steps for them?
Wow. And so it's funny, I actually have an audio download around if you're Black and pregnant, what should you do,
Oh, I
right?
love it. Where can people hear that?
So reclaimblackmotherhood.com
Uh-huh.
/social is where you can get all of my freebies, resources, reclaimblackmotherhood.com /social or Facebook, IG, Google, Reclaim Black Motherhood. We come up first page everywhere. And so this audio really walks you through people you should connect with, books you could possibly read. It talks a little bit about that birth team things. And then I also offer consults to help people depending on their circumstance. You might have a chronic condition. You might be a diabetic. You
Mhm.
might have hypertension. You might have had bariatric surgery 2 years ago. So you're concerned about what this is going to look like for you. And
Mhm.
so there's even more specialized ways that you should go about building your team. And that could look like an acupuncturist, a
Mhm.
therapist,
Yeah.
a pelvic floor person to help you in your body. That could look like also including chiropractic care, herbalist. If you want to be like me, who didn't want to take certain medications, I consulted an herbalist. I sought the earth and I delayed using medications while pregnant. I didn't care what nobody said. I wasn't using certain medications. And so depending on your scenario, your circumstance, your situation, it can go even further. But I would definitely recommend that audio and start to sift out professionals that can be trusted to help you in the I don't know.
Yes.
In advice from Auntie and this one and that one, they might mean well, but it's been 50 years for them, been 30 years for them.
Mhm.
This one's story is all full of trauma, so they just gonna tell you the bad, and you just peed on the stick yesterday. You don't need
Mhm.
to hear all the bad.
Mhm.
You need somebody to help you sift through the facts so
Yeah.
that you're not fearful of just being Black in America. And now I got to have this baby.
Yeah. And so now, what services are you offering now? Because we understand you're retired after the second
Oh
one. So,
yeah,
so what you?
it would take a lot of money to get me to come back into the game. Okay, I'm talking about way over 5,000 for me to come to your birth because it is labor intensive.
Yes.
Okay,
Yes.
and I homeschool and I like to be with my family in the house.
Okay.
And so, but as far as consults, I do parent consults, and you can choose what topic you want to speak about. Is it birth preparation? Is it postpartum, or is it feeding your baby, like lactation, preparing bottles, milk, all of that? And it's
Mhm.
a virtual consultation, a one-time fee. We can schedule it at your convenience. And that is my way of fully walking people through the resources, the classes you should take, how to get some of them for free, helping
Mhm.
you connect with someone in your geographical area. I know
Mhm.
people all over the US. So where do you need somebody? Chances are I
Mhm.
got a friend that I can put you up with, right? And
Mhm.
so that's where I walk people through that in terms of the families that can need support.
And the best way for people to contact you, is it to go through the reclaimblackmotherhood.com contact page, or is there a better
Yes.
way?
Yes. So Reclaim Black Motherhood, either IG, Facebook.com slash resources or slash social. And I'm hello at Reclaim Black Motherhood. Any of those ways, drop me a line. I'm responding to DMs in real time, giving people resources and connecting with them. So always glad to do that.
Okay, so I have put her links in the chat room, also on the write up for this episode. You can see it in there as well. You hear her passion, you hear her knowledge and her ability. Obviously, Portia is a tremendous resource. I feel like there is some blatant synergy between her and Dr. Ramantal. So goodness knows what will emerge after this call this evening. Brother Mojo, what you have to say?
What do I have to say?
Yes, darling.
No, I'm listening to the conversation, and the reality of it is there's a lot that needs to be looked at. Unfortunately, with the medical situation here in this country, we see the need probably for more doulas and more midwives coming up because of financial situation, whatever situation the family or the individual might be in. So as I'm listening to her go through all these things, I think people should definitely get in touch with her, because she has these classes. I mean, to talk to her and get your cash app ready to talk.
Oh boy. Oh
No,
boy.
because it's still, because I mean, let's be real. Okay, let's be. It's a business that someone's helping to take care of themselves. You're taking care of your bills. You got bills to pay.
Yeah.
You got to take care. You got put food on your table, about gas. So like you said, it's not free.
Mhm.
Correct.
But the beautiful thing about it is there's someone who is affordable, who look like you in your community, and who, like you said, she knows people all over the country, so she could actually connect you with certain circles that could make it affordable for you to get
Yeah.
the proper health care.
Yeah.
And that's what I'm hearing, because you don't want to hit. I just read something about what's going on in Georgia now, and it sounds ridiculous, but you have women who are dying in childbirth and stuff like that. I'm like,
Mhm.
what, in the 21st century
Mhm.
in the United States?
Mhm.
Correct.
So obviously there is a gap, and I think what Sister Portia, I'm listening to her talk, I think she has the resources to help not fill the gap, but to close that gap a little bit.
Lessen it. Mhm.
And that's what I'm hearing.
Yeah, exactly. Because some of what is happening obviously does not need to be happening anymore. We are well resourced, well educated, and very capable. And we need advocacy. And sometimes when we don't know how to advocate for ourselves, or if we're not feeling well enough to advocate for ourselves, right? We need to, and Dr. Ramantal, you've shared stories about when people go overseas, the importance of having someone who can advocate for you when if you're having surgery, if you're having a baby, if anything, you're sick, you need someone who can be there for you. And these are definitely two people, Dr. Ramantal, Portia, these are people who can help in that advocacy process. I encourage people to follow them on social media. Dr. Ramantal is always dropping these enticing videos about Ecuador and Colombia and so forth and so on. So if anything, she needs to become a travel agent on the side. But the reality is there are resources out there. You are not alone. You do not have to stay in this condition by yourself. As Portia mentioned, there are places and spaces that have financial resources, as well as educational and medical resources. Now, you have to do the work, it ain't just going to show up there, but there you can have access to it, and it can be beneficial to your life. So for all of those who are listening, we thank you for joining us this evening. Please be sure to subscribe to Ask Dr. Walls 525. Dr. Ramantal, yours is, tell them what yours is again.
Sure. Medical Tourism RN 812 here on YouTube. And then Medical Tourism RN on other platforms, TikTok, IG, Facebook, all at LinkedIn.
And Portia, where would you like them to follow?
Instagram at Reclaim Black Motherhood.
All right, there it is. And Brother Moja, where would you like them to follow?
Well, they can just go to the website, Umoja, UMOJA, photo, PHOTO.com, umojaphoto.com.
Okay, and I'm gonna tell y'all, because I'm his wife, follow on YouTube at UCCN TV, please. So we need that follow also.
That's right.
But yeah,
Thank you, Dr. Walls.
You're welcome. So much valuable information. It is important. We are a collective that we continue to strengthen ourselves. You know, we're better together. Brother Moja and I have a song called Stronger Together, and we are stronger together, and being able to utilize resources that we can trust and that we can count on, really making sure that we have the healthiest life that we can have now, as well as for our children and our grandchildren and everybody else who we're connected to, godchildren and so forth. It is of great importance that we do this.
Hey, Dr. Walls.
Yes, darling.
Can I say something?
Yes, I will give you permission.
Oh, thank you so much.
Y'all, I run the studio. I can mute them at any time I want, but go ahead.
So this is everything you're saying, what Portia and Dr. Ramantal was saying, and I just want to say from a father and a grandfather perspective, if you're not thinking about yourself, think about your legacy, think about the children and the grandchildren and the great grandchildren, and what are you leaving them, and what can you do for them to make things better? And so I'm just going to throw that at some of the men, but particularly the black men. What can we do to support our queens as we look at, we're in the 21st century now, and there is no reason why we cannot get in there and get our hands in the mix. So think about that. If you're talking about your son or your daughter or your grandkids and stuff like that, think about what can you do. And Sister Portia is giving you so many resources. Dr. Ramantal is giving you so many resources. So it's very easy to find them. They gave their contact information out. Yeah. Ask a question, man. Don't sit there and listen to your boys who've been doing a football game. Ask the questions of people who know. I mean, what's the worst thing? What's the worst that's going to happen? They give you the answer to your question.
Yeah.
So I think as a man, I'm just talking to the brothers out there. Let's get our hands in there and get our hands involved in what's going on, because at the end of the day, we like to say, yeah, that's my boy, oh, that's my daughter, yeah. So let's do something. Let's do a little bit more.
Yeah, I'm so glad that you said that, because I will say, Portia, you just really illuminated something earlier in the show, and that it doesn't have to be the father. It can be a brother, an uncle, a cousin, a friend, a neighbor, who is taking that role, who is providing that support that's needed in that moment. And you're absolutely right. There are times where they may have questions, but they may not feel comfortable asking a woman that question, or they may not be as receptive to receive the information, or it just might not click the same way. You know, how many times do you tell somebody something, but all of a sudden you hear it from somebody else and it's like it just makes the most sense. And so the more ways in which this information can be shared, it is important. Now, Portia, you talked about your husband also does some work with you. And what tell us a little bit about him before we get ready to close up.
Yeah, sure. So if you're in Philly, I have been blessed to receive mini grant funding through our Department of Public Health, the Maternal Child Health Division, multiple mini grants where I have done parenting circles and also a free community event called Black and Pregnant Philly. We just had our fourth one last month.
Wow.
So it is, and that's what I mean about other people's money to give back. So though as a consulting and coaching firm, I'm billing and charging my clients, my give backs come when I use other people's money to take care of my people. And so folks were getting a hot meal. They were getting blood pressure monitors. They were getting gift bags and giveaways, dynamic speakers. And one of those speakers is my husband. He always speaks from the father's male perspective. He is also skilled around postpartum care. He literally took care of me. I mean, when I couldn't make it to the bathroom, I'm going to the bathroom on myself. The baby going to the bathroom on herself. I mean, it gets real after birth. And so he is a postpartum guru, and he's also a lactation because he had to handle my milk. He knows about storage and rotating because I was a pumper. I pumped out my milk. And so he knows about cleaning pump parts and all of that. And so he helps me in a lot of those ways to educate or come alongside when we're working alongside a couple. And so more to come on formal services that we'll offer for couples based on some of our experiences.
Fantastic. Thank you. And just real quick, as far as I know, there's the doula. Is the male called doulo?
They can be. Yes, that is a terminology that comes up. Some just say male doula, some say doulo. So yes.
Okay. So I wanted people to know that, because if this is something that is of interest to them, or if they're thinking about someone who like this might be a good fit for them when they're going to do a Google search, don't be surprised if that shows itself.
Yes.
Okay.
And you can also, in addition to the download that I have for people that are pregnant, I have a guide on you think you want to be a doula, like how you can get started. I paid very little for all of my certifications and trainings. Many of them were free. Okay. And so particularly for any Black people coming into this work, we shouldn't have to go broke to try to help our people. Yeah. And so my guide breaks down ways to go about it, different things to think about financially, different ways that you can train, certify. And again, because I coach professionals, your girl knows I have 4 certifications. I know what this thing looks like.
Yeah.
And so glad to help people walk through that as well, if you think that this work is something of interest to you.
Thank you. Thank you. Thank you. All right, Brother Mojo, I'm going to start with you at the top. Any final words that you want to say? And I'm going to go around the table and close this out.
Not really. I just want to thank Portia for sharing the knowledge, and Dr. Ramathor for always being here with us. So just thank you, sisters, for doing it because it's needed.
Thank you.
Dr. Ramathor.
And my wonderful wife.
Oh, yes. And for those who are joining, I have no idea what happened with the camera, but it gave me the boot. So I had to find me a yellow shirt to match Portia so we could be in solidarity. Portia, any final words? Anything that you want people to know? Words of inspiration? Anything?
Well, for me, what first came to my mind is that there is joy. There is joy. There can be joy. Don't let the numbers, the stats, the foolishness, the racism, the bias. Yes, it's all true, but don't let that distract you from the joy of building the Black community through birth. There is joy.
And tell me this, of course, I know you mentioned the download. Do you have any books or anything that you have written and or will be writing?
Oh, Lord.
You don't know who you're dealing with. This is Dr. Kathleen E. Walls, okay? She will have you write a book anytime.
They're in process. It's been a year. I lost my maternal grandmother and I took multiple weeks off, and I'm about to take more weeks off. She is one of the reasons why I do this work. And so when I lost my grandmother in July, everything paused. My book, my academy. All of these things are in progress. Loretta,
Uh-huh.
ChatGPT helps me get it together.
Yes.
And so it's coming. I can make book references. I have several of them on my website. I can
Uh-huh.
make references, but my own has not yet been birthed.
It hasn't been
We're
birthed
still
yet.
pregnant. We still
Okay.
pregnant.
All right. How many months pregnant are you?
We about 12 months pregnant, so we're a little overdue.
Dr. Robinson said y'all might not be able to see her face, but I know her face.
I was like, why would she come for me like this on tonight?
Listen, she comes for us all. there's a whole bar. She's gonna get you. If she's gonna get you to write a book, she will get you to write a book.
And y'all in the chat room, y'all hush. I don't want to hear nothing from none of y'all talking about, yeah, we know. All right, I'm just sharing what was placed on my spirit.
Not a problem. It's confirmation. It's
Yes,
coming.
it is.
2025 is my year. It's
Okay,
coming.
that's what's up. And if you need any, help, guidance, support, just let me know.
Absolutely.
I'm here to push
I appreciate
and
you.
pull and drag when necessary.
Not drag.
She will.
Lord.
She'll get you there, though. She'll get you there.
We're gonna cross that finish line.
Okay.
Now look.
All tore up on the
Yes.
way.
Now, speaking of which, I'm gonna hop on over here to Dr. Ramantal. Any final words for tonight? Anything that you want to share?
This was amazing. Thank you again, Dr. Walls and Brother Moja, and even just Portia, the wealth of knowledge you have and just your zeal for this work. It's infectious. I love it. And if I'm not out of turn, Dr. Walls, I would love to invite Portia to be a guest on my YouTube channel to speak from a different perspective, literally because we know so many women are deciding to leave the U.S. For their birthing experience. Having you come and discuss what Black women should know and ask if they decide to leave to give birth abroad. Just some tips that you can share, that type of thing. I think I'd love to build a show around that with you as a guest. I think that would be amazing and really helpful, especially after the inauguration. I think we need to do this really quickly. And I'll say that.
And I'm glad. I want you to tell people about your show because this is hot off the press. So
I was encouraged by guess who? Person that's here talking about books, right?
That's the midwife right there helping the baby come out.
I done birthed a whole lot of stuff.
Yes. No, I usually do videos where I just do the education, but starting last month, I decided to go live once a month, the first Wednesday of the month, to bring on a guest to talk about various aspects of medical tourism. And Dr. Walls is my first guest to talk about the psychology of medical tourism, because so much goes into making a decision to even go abroad, much less in your probably most vulnerable state, because it's your healthcare. So that was a really good session. And then yesterday I had 2 Black females talking about medical tourism facilitation. They are certified medical tourism facilitators. They help do all the processes pre and post and make sure that everything's taken care of no matter where you go around the world. They vet all of the people you see. So I'd love to, because I know that a lot of viewers have asked me specifically about birthing experiences, to have maybe just kind of share tips, experiences, and that kind of thing. Because I already have 2 videos out there about the safest places to go and IVF locations. But to hear, what should I ask? What should I even think about if I'm going to go abroad and do this? So I would love to have you as a guest to talk about that.
I'll make sure I connect the 2 of you.
Thank
you. Of course. And Dr. Ramantal, for people to see the past shows as well as the upcoming shows, where do they need to go?
So YouTube, you'll find me at Medical Tourism RN 812. So that's where I have all my content as far as long form, shorts, and then the show that's live streamed, much like this.
Okay, perfect. All right, so everyone, Brother Moja, anything else you wanted to say before I get ready to close?
No, I'm done. I'm good.
You good? Okay.
I'm good.
All right. Good. Portia, anything else you needed or wanted to say before I get ready to close?
No, just a thank you for this conversation.
You're welcome. You're welcome. I got to get it in because, the next time we're back on with Sisters for Harmony, it'll be 2025. So,
Oh,
okay, because here we are, December. So, but I will be doing some shows again for those who are listening. Thank you for joining us. If you have not subscribed to Ask Dr. Walls 525, I encourage you to do so. Some of my other shows are Planner's Knowledge Vodcast, where I interview authors. I have several author interviews coming up in the next couple of weeks. I highly encourage people to write books
I
as
knew
well
she
as
knew
and to read them, which is why I do the Planner's Knowledge podcast to introduce people to authors and the different genres and to hopefully provide some inspiration, encouragement, empowerment, and motivation because we each have a story or stories or knowledge or something that can be shared with others. Planner's Knowledge is my publishing company, and the planner is God. And I believe that God plants knowledge within all of us. You heard Portia's story tonight, where this was not where she started, but this is where she is, and this is her calling. And the call came and she answered it. And she has continued to answer it in all the work that she does. Same with Dr. Ramantal with the medical tourism. That wasn't where she started, but that's a call that came and she answered it. Brother Emoja with being a filmmaker, that was not the original call, but that's the call that came. Me dragging people to write books, I happily answer that call all the time. No, just like, but I encourage people to birth their greatest self. So all jokes aside, that is my purpose to help people to live their greatest life and to answer the call and not be afraid of the call that is coming because we need each and every one of you to fully be all that you have been divinely designed to be. And in any ways in which we can help you do that, that's what we do. This is why I do all of these different shows to speak to the different parts of you and to be the full expression of who I've been created to be as well. With that said, we wish everyone a happy end of the year, a happy holiday season, whatever you choose to celebrate. If you do celebrate any and all of it, even if it's just Thursday, happy Thursday, uh, and encourage you to be grateful for the breath that you have and all that comes from it. Um, I also am excited to announce for those who don't know, I have opened up the official Froggy Tea and Bunny Hop Shop. It is the FTB Hop Shop with all of the Froggy Tea and Bunny merch. So there are sweatshirts and mugs and blankets and puzzles and all types of goodies and incredibly cute onesies. So definitely please check out. You can go to ftbhopshop.com. There's also a link right here in the room as well. And everything is free shipping. So knock yourself out. Come on over and shop and get some goodies. And then all of my books are listed. There's a link where all of the books are listed. There's 5 books currently in the series. There is also a coloring and activities book. I would definitely say ages kind of like 3 to 7. And then there are journals as well, and the journals are hardback journals. So there's a lot of goodies, and I'm super excited. There's some custom pillows in there that I just put in last night. So y'all go ahead and look at all the little cute merchandise that's in there. Um, I think that is about it. We are in current production of season 4 of Kadaga, our web series, which is about eliminating human trafficking in all of its forms. Season 4 will be coming out in 2025. So if you need to catch up, you can go to UCCN TV on YouTube and you can see the first 3 seasons there. And yours truly is the lead actress, Lioness. And let's see, I think that about wraps it all up. So we wish everyone a happy, happy December. We will see you in the new year on Sisters for Harmony. Portia, thank you, thank you, thank you for answering this call and joining us this evening. And Dr. Ramantal, thank you once again for hanging out with us and sharing your knowledge. And to all of our listeners, thank you. And as always, God bless and continue to live your greatest life. See you soon.
Every woman